Good morning, everyone on board. This is Ayush Jain from ArdorComm Media. I welcome everyone on board for the new normal healthcare leadership summit and awards 2022. So let us start with the introduction for the first panel. The topic for the same is how has adoption of new age technology redefined health services. And the eminent panel speakers for the same are Miss Upasana Arora, Director of Yashoda Super Speciality Hospital, Dr. Anoop Mehta, Managing Director of Navjeevan Hospital, Mr. Rupak Barua, Group CEO and Director of AMRI Group of Hospitals,
Welcome, sir.
Dr. G.V. Divakar, Managing Director of Divakars Speciality Hospital,
Welcome,
Mr.
sir.
Shuchin Bajaj, Founder Director of Ujala Cygnus Hospitals, Dr. Mukund Penurkar, Managing Director of Sanjivan Hospitals. He was felicitated by the tremendous work during COVID by Health Minister of Maharashtra Rajeshri Tope and Leader of Opposition Devendra Fadnavis. And Mr. Chandan Anand, CEO and Founder Editor of ArdorComm Media Group. He will be our session moderator for this session. Thank you so much, sir. Over to you, sir.
Thanks, Ayush. Good work. So, with this now, we open to with the first panel session of the day, and what no, what a good start we had since morning when we have two IS officers. Then we had an industry presentation from the corporate, and now the stalwarts who are representing one of the finest and the biggest healthcare sectors and the hospital chains of the country. How has the adoption of new age technology redefined healthcare services? A very apt topic to this. And I would not go with the background of the panel discussion, but let me directly put a question with by opening remarks of our eminent speakers. May I please invite Ms. Upasana Arora. She is the board member of Ethical Committee, AHPI, Director, Yashoda Super Speciality Hospital, Kaushambi. Ma'am, I've been following you recently since the time when you got associated with ArdorComm for your confirmation, and I truly admire the way you are presenting yourself as a role model, being a woman entrepreneur, and many people aspire you by seeing your dynamic position and your versatility in the work, ma'am. From where do you draw this inexhaustible motivation to achieve so much? With your introduction, personally.
Thank you so much, Chandanji. And I am thankful to ArdorComm that they have given me this opportunity, and happy to see a few of my friends are also in this panel. So answer to your question is, actually, if you really want to do good, you are supposed to take lead role. Otherwise, you are talking about that best practices are not, following in the healthcare, or people are not doing this. But why we are talking and why we are expecting from others, we are supposed to do. And our today's session is very interesting, new normal. So at the time of Corona, we offered our hospital with 250 beds for Corona only. And that time we realized that how people are suffering. That was such a painful time, especially in second wave. That time, this new normal means this telemedicine thing and this gadgets friendly people were really in ease, because now that time, like cancer patients, they are really vulnerable. So they cannot come to the hospital because of, they can get other infection also. They were using this telemedicine thing. And I am this, in this budget, our finance minister already given us a big gift, because she has given this license to use telemedicine for even mental health, which is a very big boom for healthcare industry. So people were using telehealth, as well as there were lots of apps were there. Even Arogya Setu was, everyone was using. And now we are getting lots of other devices also. So like patient is at home, and after discharge from the hospital, we can monitor that same patient from a device, through that device, and our doctors and nurses can keep an eye on that person. So these things are now actually very good. And if you talk about myself, so I am involved with lots of things like NABH. But my life has changed when my hospital got accreditation from NABH in 2010. We are the first hospital in this area who got NABH. But NABH changed my life in the sense that I realized that if you focus on patient safety, then everything will come automatically, because you are focusing on patient safety. Then right drug, right time, right site surgery, and right patient, everything is covered under one roof, that is called patient safety. So after this NABH accreditation, and I have done this ISQA fellowship, which is also related to patient safety. So if you see, these technologies are also helping for patient safety. When someone is using, there is a, like in my hospital, patient need not to come back for the report collection. He can get his reports on my portal, my website portal. So it's very easy for him to get through his reports through his unique ID. So because of this unique ID, there is no confusion about patients. Like, few years back, there was always a confusion that Sunita Devi got report of another Sunita Devi. There are many Sunita Devi can be in a same lab or in a hospital. So nowadays, because of these technologies, things are changing drastically. And we are actually, like today, we are doing this webinar on online, on Zoom. Such a wonderful thing that people from different areas are sitting together and we are discussing, listening each other. So new normal is we need to always take care of our health in form of hand washing, in form of masking. We need not to, always create a big gathering, because you never know when Corona can come back. But same time, we are supposed to be technology friendly so that we can look after ourselves. All these apps are available on even phone, that you can do your ECG, you can take your reports, lots of things which are actually happening in the industry and healthcare. If you see, this robotic surgery has changed a lot. Our surgery scenario has totally changed because of this robotic surgery. And in healthcare, all the devices are connected to the computers. So everything already, digitalization has already happened. And now by day, we are going modern and we are going, cutting edge technology. But same time, I must say that one needs to be always human, because there is one thing called human touch. When a doctor is keeping hand on a patient's head and he is saying everything will be fine, you don't worry, that is a different thing which we cannot get through all this technology. That is always required from a doctor to his patient. So with these words, I would like to conclude that. Thank you so much.
Yes,
Over
ma'am.
to you, Chandanji.
Lovely, ma'am. Thanks for that opening remark. And may I please invite Dr. Anoop Mehta. He's the Managing Director of Navjeevan Hospital from Hyderabad, for your opening remarks, Dr. Anoop.
Good afternoon, everybody. I'm very happy to be here on this leadership summit, New Normal Healthcare by Ardor. It's a very nice place where I can share some views of mine. During this COVID, we have learned a lot. We have managed a lot. We have changed a lot. And with this COVID, we have ultimately understood that we have to use this technology for our normal survival. We have been using the technology at various fronts. As a hospital owner, I have to see that my staff doesn't get exposed to many people. The patients who are coming with some other difficulties should not be exposed to COVID patients. All these things, what we had done during this COVID period was we had gone paperless completely, so that the exposure of people to the patients and basically the movement in the hospital also reduces with paperless facility. We don't have to go to the lab to collect the reports. We don't have the movement will be very, very limited. Even the doctor doesn't have to go to the bedside again and again just to see the readings of labs or of vitals. All those were seen on the screen. So technology has definitely helped And I see that in future, this is going to be more useful and will be able to scale up things. Limited number of people will be able to do more and more work because of the technology. With this, I would conclude my opening remarks. Thank you.
Lovely, sir. Short and simple. Thank you so much. May I please invite Mr. Rupak Barua. He's a Group CEO and Director, AMRI Group of Hospitals, Kolkata. Over to you, Rupak, sir.
Yeah, thank you so much, Chandan, and good afternoon, everyone, all the panelists and the audience, actually, virtual audience. If we are sharing about this, your healthcare as of now today, we are talking about this, your healthcare, how healthcare actually has during this particular time, actually, we had made this your healthcare possible. We are all talking about adoption of the technology and more of this year, what is the new normal situation. But the new normal, actually, if we are talking about from the normal to new normal, we had passed through a very abnormal situation. And that's why we are now talking about the new normal situation. The abnormal situation, that's an unprecedented time that we had passed through. And it's a absolutely once in lifetime, actually once in a century, one can make this kind of a pandemic. So this pandemic situation, we had learned a lot. Now, you see, if we are talking about my personal experience, yes, of course, everybody was sharing over this. It's like 2 minutes. I would like to share my personal experience here. In our group hospitals in Eastern India, we are having 4 hospitals. So the first, what we did actually, the government actually taken over one of our hospitals as a dedicated COVID hospital. That time we are not having any idea about the COVID. What is COVID? It's an invisible enemy. There is that's an invisible guest actually. We do not know the behavior of the guest, how that guest will behave. So that's a very predictable time that we had passed through. Yes, that was a 66 bed out of one of our unit, half of the unit, one of the tower actually we had given to the government, 66 bed. But the journey actually started from there, and that is the initial starting. These 66 bed over the time we had converted to 1,000 bed. That is our journey. 1,000 bed is not in the hospital. In our 4 hospitals, we have converted around 400 beds. Just the COVID I'm talking about, out of about 1,200 beds. But that's your satellite center, then your field hospital. We have converted one of the large stadium, which is one of the largest stadium, is the Salt Lake Stadium. This is one of the state-of-the-art stadium. We converted it as a hospital, field hospital. So these are the areas we have taken over 3 5-star hospitals actually as a converted to a hospital. So these numbers actually accumulated to the 1,000. In some time, it has happened that around 900 to 950 patients we used to keep during this out of this 1,000 bed, including hotel, including the field hospital and the hospital our part. So, but these only put possible because of the technology. We have adapted technology. I think all of the healthcare all over the global, it's a global crisis. Everybody has adopted technology. But this true technology, we are discussing about the importance of technology in the new normal segment. This is the technology actually we could manage, we could overcome those challenges actually through this technology. We had adapted many ways. We had initiated robot, we had initiated all the touch-based, all the doctor's documentation, the patient documentation, patient counseling, everything is a touch-based through this robotic system, through this app system. So many ways we had adapted the technology, and this we can tell you that we used to talk about the technology, but this pandemic actually had given us a lot of support so that we had accelerated this technology adoption part, and it has given us tremendous kind of a support in terms of patient access and your clinical outcome. These 2 areas actually we have taken care, and we really want out of these challenges. And yes, of course, challenges are there, but I think I fervently believe through this technology we'll be able to overcome any kind of challenges which is coming in this part of healthcare delivery system global wise. Thank you. It's my take.
Great. Thank you so much for those inputs, sir, and the way we have you have done the work for your hospitals. You have extended and converted stadiums into hospital. I guess most of the players have done their part in delivering what best was possible in their capacity to do that. I'm happy to understand that from you, sir. May I please now invite Dr. G. V. Divakar. He is the MD, Divakar Speciality Hospital, Bangalore, for your opening remarks, sir.
Good morning, everybody. I thank ArdorComm Media and Chandan and Itisha for arranging this excellent seminar on what are the new norms we have to follow and we are following in these types of COVID times. So we have got a training institute attached to our hospital called Asian Research and Training Institute for Skill Transfer. We will train the nursing staff and housekeeping staff through digital media. Directly we used to do earlier before the COVID times, we used to call them in groups and take classes. But after this, digitally we started giving training through the Zoom platform, and they can, it is most easily reachable to all the remote areas. No need of the staff going there, because in the COVID time the movements are restricted in all the hospitals in all the areas, and they can get training on the management, how to provide the patient health care during the COVID times, how to take precautions, how to do the hand washing. Everything is to show them to the digital platform, and it is cost effective also. No need of spending so much on travel like that, and even the training staff like that, they can see from their own mobile phones, from their homes or wherever they are located like that. So this is helpful digital training, and this is the first thing which we have done. And this teleconsultation has helped patients to get experts advice from their home only. Instead of coming to the hospital due to the restrictions and other things, they can get the expert opinion from there. And there are some devices where they can monitor their health from their home only, and report through the app or hospital app to the hospital, and they can get our opinion. So this is the new instruments which are followed for the training and for the treatment and the management of patients. Thank you.
Lovely. Thank you so much, Divakarji. May I please invite Dr. Suchi Bajaj, the founder, director, Ujala Cygnus Hospital, from Mr. Shuchin Bajaj.
Hello,
Yeah.
thank you, Chandan. Thank you very
Yes.
much. So,
Yes.
yeah, I think we've had a lot of learnings in the last 2 years. The new normal is truly something which is very different from what we were looking at exactly 2 years from now in early March 2020. We faced a lot of challenges right from supply chains, when even normal masks became unavailable very early on into the first lockdown, let alone PPE kits or N95 masks, to the second wave when oxygen ran out, which was unthinkable in the 30 years of being in hospitals that I've been. We never could have imagined that hospitals would run out of such a thing as oxygen. And of course, the first and third waves were very different from the second wave, which had almost negligible hospitalizations of COVID patients, and in addition, the electives and the surgeries were completely gone because of lockdowns and the unwillingness of the general public to go to hospitals for anything in fear of catching the infection. So a lot of things we learned. A lot of experiments were done with supply chain optimizations, experimentations, telehealth, digital health, and as Dr. Barua said, we also set up a lot of temporary beds, and we learned how much executional capabilities we actually had, which we ourselves were not sure of. So when the second wave was hitting us, we understood that it is a huge wave coming in, almost like a tsunami, and Delhi and UP had no beds available, of course, even Haryana and eastern Rajasthan as well. So in collaboration with the Delhi government, we set up a 1000 bed fully oxygenated, completely free of cost to patients COVID hospital in a field setting, with 308 ICU beds. It is still the largest field ICU in the country, and that was set within 7 days of the first conversation about it starting. So that was a huge logistical exercise, and we realized that we had those capabilities. We also set up a 100 bed free of cost COVID hospital in Prayagraj in UP in collaboration with the UP government. And of course, all our hospitals, all the 17 of our hospitals were already giving COVID services to the community at highly subsidized rates. Being in small towns also meant that we had started getting increased loads of elective patients because they were now not able to go into the big cities which they earlier were. So our load of joint replacement, spine surgeries, cardiothoracic surgeries, that started increasing. We were already doing a lot of interventional cardiology, emergency services, neurosurgery, trauma, etc. But elective surgeries in these formats also started increasing a lot for us. So we had to recalibrate our capacities and our human resources accordingly. So a lot of learnings, I think all good learnings. Whenever I've learned that whenever you have severe constraints, that is the time we operate to our maximum efficiencies and to our best. As soon as we start removing the constraints, we start going back to our lazy selves and start explaining to ourselves how things don't really work. So the constraints do work well for us, especially I think the medical community reacts very well to operating in chaos and under constraints, and that was, I think, visible very clearly in the three very distinct waves that we saw over the last 2 years.
Lovely, sir. You with your speech, you just took us to the same story. I started imagining myself putting into that situation, and the way we have evolved. Hats off to all the warriors over there, and definitely to the leadership shoulders of yours, which has kept yourself motivated and the rest of the team motivated. Thank you so much for that input, sir. Now, may I please invite Dr. Mukund Penurkar, sir. He is the managing director of Sanjivan Hospitals, one of the finest hospitals of Pune. Dr. Mukund Penurkar, sir, for your opening remarks. Yeah.
Thank you very much, Mr. Chandan Anand. To start with, I would like to congratulate you for taking such a good initiative, along with Itisha madam. Actually, overall, if you see, we have almost changed everything in 2 years. The way in which we used to practice has definitely changed a lot, because 2 years back, even myself or many of my colleagues would not have believed that we are going to have such digital technology, and wherein we are going to have some healthcare platforms. But everything has changed in 2 years, and it has changed for the good for the healthcare community. Nobody would have imagined many people from many cities sitting together and discussing so many good things. So to start with, initially when the first wave had come, maybe in March 2020, even we didn't have any knowledge regarding this COVID. And before that, we did not have any such patients. So we had a lot of knowledge because of the digital healthcare, and so much of knowledge was transferred from one city to another, from maybe one country to another country. There were so many seminars, and I think even I didn't know about the Zoom and those platforms wherein we could connect each other. But they definitely helped a lot during COVID. And now, after the COVID is over, we definitely are going to get a lot of help from such seminars and the transmission of knowledge through the digital technology. So it is a very nice platform, and I think everything has changed in last 2 years. Thank you very much.
Yes, definitely, Dr. Mukund sir. We can totally align to the talk which you just said. But gradually also we have also evolved, and the way Dr. Shuchin was saying that with this we have learned a lot, and we have tried to fight the situations in where we are. We are not afraid of anything now. So with this opening remarks, I would. We definitely come to know across your special initiatives under your leadership and the organizations which you are representing. Now, let me do some deep dive to the thematic topic, and with a brief inputs I would like to raise first to Miss Upasana Arora ji. I would like to ask you, ma'am, in what ways new age technological advancement have gained prominence?
Yeah, you can see this new age technology is actually after this COVID, but I should say before COVID also.
Ji.
In healthcare, technology is playing a major role, especially when we talk about artificial intelligence. These things are going to take over. Within 5 years, you will see a total change healthcare industry. As we are already changed a lot, and now things are more more computerized. People are more, doctors are more computer friendly, and I must appreciate our honorable prime minister. He has taken a very good initiative. I was also part of this webinar when our honorable prime minister addressed the nation and addressed the healthcare industry for this Ayushman Bharat digitalization. I got the opportunity to speak in this on this webinar, that everything will be related to Aadhaar card. Our e-health will be there. So all the hospital has to keep record. This all patient record will be computerized. So anyone can go anywhere and they can see their record. Like, it's a very convenient for us. Like, I travel a lot because of my profession. I travel a lot. So if I am not feeling well, and every time you are not keeping your records with you, so at least you can go to any hospital and you can see, and a doctor can check your records. So when this policy will be totally implemented in the India, things will totally change, and we will create we will be Vishwa Guru. Why? Because our population is very high, and we have proved in form of vaccination. Everybody was getting a message on their mobile that this is your slot is booked in this hospital, reach there. So we have already proved this, that technology can play a major role. And this Arogya Setu app was there. I am talking about even government apps. And in private, you can see lots of apps are available. Every hospital is having their own, all labs are having their own apps and their own websites, where portals you can see, and you can get all your information from that. Not only this, if you go to a hospital, you can see that there are lots of standees are there, where we are displaying our infection control rates. So patient is quite aware about what is happening in this hospital. And all the procedures you can see nowadays. It's again a very good thing which hospitals are doing. It's a best practice that we are displaying educational videos in big screens, and few channels are taking this responsibility. They will providing you screen, and you are running this thing. All these technology is going to make awareness among everybody, that if, like Google, everyone who is coming to hospital, first he is going and checking if I am having headache. But sometime one should not only going through technology, there is always a need of a expert. So you cannot only rely on Google or rely on technology. You need to go to a expert doctor, and then you can take any decision. But same time, technology plays a major role to resolve these issues. At least you can book your appointment, so you need not to wait there. You can pay in advance, so you need not to pay there. So lots of other things which are helping in form of technology to healthcare.
Right,
Thank you, Chandan. Over to you.
Thanks, ma'am. Well said. My next question I would like to put to Dr. Anoop Mehta ji. Sir, in what ways teleconsultation practices has helped to minimize the spread of COVID-19? Your inputs on it, sir.
Thank you, Chandanji, to allow me to share my views on this. Teleconsultation, after it has become legalized, it has become a very, very important mode of consultation now. It has helped in many ways. It decreases the time involved, it decreases the cost involved, and safety is definitely there. Non-COVID patient definitely doesn't want to come to the hospital where COVID is being treated, or even if when the COVID waves are going on, they don't want to come out of the hospital also. In that, many of the patients with chronic diseases like diabetes, blood pressure, or coronary artery disease, which required regular checkup, which required regular updation of things, were not doing it. And some of them have actually got in problem because of those things. Diabetics who were not having sugars under control, they developed some complications like diabetic foots and chronic kidney disease and etc. So teleconsultation had definitely helped them, many of them who has availed that facility, to keep them under guidance of a doctor very easily without coming out of the house. Second thing, we have used these teleconsultations in managing patients during these waves, even the COVID patients. COVID patients, we have managed almost around 1,000 patients at their home. Like we used to ask them to enroll for a package for 14 days during the second wave, when we used to call them every day. My team was there, which involved even paramedics. Nurses also used to help us in that. Every day they were given a set of questions. These questions you have to ask the patient, and if there is any red flag, just transfer the call to a doctor. So that those patients were under a guidance, and whosoever was deteriorating or was requiring some other help, they were suggested accordingly. So in that situation, with the limited staff which was there during those waves, we could cater our services to a very huge population. That was very good point by which technology had helped us in catering more people. One more thing we have done of late is we are providing critical care services to the rural areas. So that also teleconsultations, telemedicine has helped us in providing our services from the city to the rural doctors, to the villages. We are guiding them over our application, and we are trying to tell them what can be done, what should be done, what is the prognosis, how you should go about it. So whatever experience we have, whatever facilities we have in the urban areas, we are trying to share that with the rural people also. So all these things have helped us in doing a good job, doing a better job than what we were doing previously. And COVID has taught all this. This is what I have to put. Thank you very much.
Great. Thank you for those inputs. I would like to ask Mr. Rupak Baruaji. Sir, do you think India is far behind in technological adoptions to redefine healthcare services and patient outcomes?
This is a very interesting question you have asked, Chandan. That is, in today's situation, where we stand. But before we go to that point where we stand vis-a-vis to this your world, global adoption of that technology, I believe, personally, yes, of course, many of my fellow panelists will believe that way, that whatever the challenges we are facing today, pandemic, post-pandemic, whatever, because the major way healthcare sector actually impacted out of this year pandemic. And there is a lot of innovation is required just to overcome these challenges. I only believe that the global healthcare delivery system, whatever the challenges which we are facing or we are going to face tomorrow, can respond to the toughest challenges which will be to the help of technology, that which we have mentioned basically. Some of my fellow panelists was talking about the constraints, because there were a lot of constraints, but there were a lot of challenges, but we could overcome. I believe that the constraints actually has created the opportunity. I believe that, and itself it has happened that we have certainly seen that the rapid increase of the digitization since the pandemic began, it is because of the constraint, and that's the opportunity that we could see. If you see that there was a McKinsey survey of the global executive level, found that the companies, in all the interactions and all of their internal operations, that we have accelerated to 3 to 4 years. And if we are talking about the health tech companies, that is those who are developing this healthcare, the apps and all those things, they have accelerated the products in their portfolio. They have accelerated almost 7 years of their innovations and all, particularly in this healthcare and pharma. These are the things actually has happened. But if we are talking about these are the accelerations part and all, but COVID has been actually attributed as a tipping point. It's driving that digital transformation, and these changes will be long lasting. That we can show that whatever the changes has taken place or taking place, it is going to last a long time, for many years. See, for the many years we are talking about digitalizations, technology and all. But yes, of course, that we have seen that those discussions actually taken place and action has been taken, adoption has been taken, and that is and the population actually they have started accelerating this accepting this process, and they had made this one as a new technology. Now, if we are talking about is a far behind this the technology, the global, yes. If we are talking about global means, if we can talk about US or the European countries, they are far ahead of this other technology. That is all we know. That is nothing new. But in during this pandemic time, we have come to the closer to this adoption technology. But our problem that we also need to understand, if we are constantly comparing with the global standard, we need to understand that almost 70% of our population actually is in the rural area. Rural area, if you see, only out of the 70% of the population, 63% of the population actually has access to this internet. Because if there is talking about technology, but the technology takes this is an adoption, this is acceleration, and this integration as well. If that doesn't happen, then it is not going to reach out to the standard level. So rural area actually that is a major area of concern. But over the time, if you see, the 93% of the millennials actually now they have the smartphones, and the Gen X part. I mean, if you are talking about the up to this around the 60 years of age, almost 70% of the population they are having also the smartphone. So because smartphone is the accessible part, this is the major area where people can get access to this any kind of technology. So in healthcare today, we can see that all the hospital healthcare something delivery part, there is all they have adopted this mobile app. Now you see most of the access also for the doctor's appointment, in IP, indoor patients, the reports delivery, everything is going through the app. And these are the populations actually they are using app, and their adoption is much higher and much faster than it is now going on, because there is out of the constraints they are doing it right now. Now, if we are talking about the part and the technological adoption, redefined India far behind. There are some of the areas actually we are really far behind. That is one is the medical equipment part. Many equipments today, that very advanced kind of medical equipment, this is available in other parts of the country. There is the adoption is very high, but because of our cost part, because of our affordability part, most of the areas we cannot afford. That's why we are little bit the backbench actually we are sitting. Now, if we are talking about the medical research, they are far ahead, but because of the big data access when we are talking about, we are little slow. The adoption of the medical, we are talking about the EMR, the medical records part, that is also a little bit less. So that's why we are not getting access to the research document and the research, because for the research we need big data, and that is not available. But yes, of course, it is going to happen. Now, one part is a major part. This is the robotic surgery. Though we are talking about robotic surgery in place in our country in maybe in the almost 10-15 years, but adoption is very late because of the, again, affordability is the question, because one machine is a cost very high, and also the technology part, that is the networking. That now you see China and many other places, they have adopted the 5G technology. 5G technology, they are doing this, some of the surgery sitting in one city and doing surgery in other city. Because in particularly in India, That is it will be very, very effective, because in the rural area where there is no, but the only constraint is that is the network. But yes, of course, the government has taken over this digitization has one of the major part, as some of the panelists were talking about, is the government budget also. They have allocated a lot in the digitization part, so that 5G technology will be able to reach, able to access now. And there is a 3D printers and all. Many of the other countries, UK and US, they are using this technology, 3D printers technology, for this your many areas. That is your all the consumables and all. They have started the implants. Those are the areas actually they are using a lot this 3D printer, where we are little behind. But to conclude my subject of discussion, if we see this, the way we are progressing right now, the way this your adaptability is taking place, the way these the millennials, the next generation, actually the adoption of the technology is very fast. So definitely in coming some years, we'll be able to standardize our your technology services compared to any global country, first world countries. That is my view. Thank you.
Great, lovely, well put, sir. So I concluded that you are mostly favoring the way technology adoption has, been penetrated in not only the urban cities but also in the rural area. But whereas in terms of the cost coming to it, or the ease of use coming to it, we need to adopt more. We need more of training and learning to it. So with this, I come up with a question which I would like to put to Dr. G.V. Divakarji. So when we are all talking about the use of the technology, e-health and digital health, how training and teaching plays a crucial role? And would you also like to put some thoughts on the limitation of digital technologies?
Thank you. As I'm the secretary of the Private Hospital Nursing Home Association in Bangalore, so many 400 to 500 small hospitals throughout Bangalore. Technology, we used to tell them about the COVID appropriate behavior and how to manage the patients, how to wear the PPEs, how to everything. We used to teach you the digital technologies, and even for the bed management and for the drug distribution to the secondary, there was quite a lot of demand was there. With digital portals were created in our website, so that hospitals can access to the website and shift the patients, or we can shift the patients to the oxygen requirement beds, or to the ICU beds, like that. Limitations is normally if there is IT, that internet is not accessible in some areas, so where the Airtel or whatever broadband is slow, there it will be difficult for them to take the training. So in such patients or places only, we have to send physically, we have to send the people to train the staff. In other places, most of the places, it's quite helpful for them to get training through the digital technology, that is either smartphones or the apps or the iPads, like that. They can use this to get training, and they're well versed with that. And it takes short time also. At any YouTube links will be sent to them, so that at any time they can go revise it and go through it to get training once more, revise themselves once more, like that. In this way, it will be helpful. It is helpful both for the nursing staff and the housekeeping staff, and also for some doctors who are general MBBS practitioners to get specialized lines of treatment. We did the message, conveyed the message to the recorded message from the specialist doctors to those doctors in the YouTubes or links in the website. So it's helpful both for the doctors, nursing staff, and the housekeeping staff also in training. Thank you.
Great. So thank you so much for those inputs, sir, because I wanted to understand about how training is also, playing a very crucial and important role. So with this, I would like to again invite Dr. Shuchin Bajaj. Sir, I would like to understand how technology, or can technology really uplift the healthcare services in especially the rural parts of India?
Yes, I think technology, in fact, Chandan, is the only way to do it, because see, India is such a vast country, and if we include other parts of South Asia and Africa as well, we have some of the least served communities in terms of healthcare. We work with many such communities. So Uttar Pradesh and Uttarakhand, if you see, their population is more than that of Brazil, almost close to that of the United States of America. And you can imagine and compare the healthcare facilities available compared to those two countries in these two states. So technology is the only way. We certainly cannot go down the American route of pumping in trillions of dollars into healthcare facilities and then having healthcare outcomes which are worse than that of Cuba, because of the skewed fee for service model that they have. And we do not certainly have the capability and the capacity to have government budgets to the extent of the Western European countries, which are huge in terms of avoiding definitely out of pocket expenses, but at the same time putting a large strain on the government systems. So, technology, as I said, is the only scalable way and the cheap way to reach the last mile and the last person. And we have been doing that, in fact, very actively over the last 2 years. As I said, the first wave that came in was kind of a not even a ripple, I think, let alone a wave. So uh, we were all ready to treat the patients, but there were no patients. It was a hard lockdown, and the electives completely went away. The OPDs completely went away. Even our staff was finding it difficult to reach the hospitals because their villages would block the roads and say, if you ever go to a hospital now, you can never come back to your village. This was the kind of the scare that the first wave showed us. And like all lazy people, we had also convinced ourselves that since we are working in rural areas, in communities that are not very tech savvy, as we used to call them, we don't really have to do digital or technology, right? Our communities are not ready for it. But then we were thrown off the cliff completely, because of, as I said, zero patience. And then we realized that we had to keep in touch with the community, because if you lose your touch, then of course the community forgets all about you, as well as starts getting complications. So they don't manage their diabetes, they don't manage their hypertension, and they all start getting complications, and then they land in the hospital with huge complications. So we started our first telemedicine solution in 3 days flat. And at the peak of the pandemic, we were doing almost 10,000 calls per day on that platform, because everything else was completely done. And we had patients coming in, like we had a knee replacement patient who got admitted into our Cathal hospital entirely through teleconsultation. It was unthinkable when we started in Cathal. That's a town I don't think many people have even heard of, that you will do a total knee replacement surgery there, let alone that knee replacement surgery coming in through an entirely teleconsult from a patient who had never seen the hospital earlier. So at the same time, we started a voluntary initiative, as it was earlier called Founders versus COVID, and then it changed its name to Startups versus COVID as more and more people joined. And then later on, it is now being called Project Step One, which is the name that it has been labeled with now. And we have almost 10,000 doctors volunteering on that platform completely free of cost. It is an entirely digital initiative working with 21 state governments now. And it provided each and every kind of support that was imaginable. Dr. Divakar knows we had a woman helpline on that as well, with ma'am working very well on that. And we had everything from say COVID positive triaging to home isolation monitoring to plasma bank therapies to vaccine ushering. And till that date, the Project Step One platform has done almost 9.8 million calls on that platform, and it is an entirely technology driven initiative. There is not a single brick and mortar framework there. We don't have an office, we don't have an office bearer, we don't have any salaries, and most of us have never met each other. I have never met Hema ma'am physically as yet. It has only been through these platforms that we've been working together. And some of the co-founders of Step One, I am being one of them, we met for the first time when the Puducherry government wanted to honor us on Republic Day, and they all invited to fly down. So everyone flew down to Puducherry, and that is where we met for the first time. So this was something that led to a lot of learnings. And since, as I said, we work in Uttarakhand, Uttar Pradesh, and the hills of Kumaon is a region that we work very closely in. and that is a region that is, I think, one of the most underserved region in terms of healthcare. So this is where we started our digital healthcare company from, which is now called Medfo. Medfo is short for medicines on phone, and it is also at the point of care a completely free of cost teleconsultation service. We provide a completely free of cost teleconsultation service for the community. You can just call us anytime. And as we realized that you need to be where your community is, so we didn't create an app or anything. We just work through WhatsApp or feature phones. You just call us or send us a WhatsApp message, and the doctor is always available. And in that also, we are almost doing now 20,000 teleconsultations per month. And the revenue model is of course very different, because it is not for profit, it is a for profit company, so there has to be a revenue model. So we integrate a lot of other features. So your basic teleconsultation is free, which decreases your long term cost. You can detect diseases early, you prevent complications. But if you want to go a step further, like consult super specialists or get your medicines delivered to your house or get some tests done, that is something that the revenue comes in from. So Medfo is doing very well in these communities because there is no facility for them. So I think we've done a lot of technology work. As I said, supply chains in my opening remarks. Supply chains have been completely, transformed in these last 2 years. Everything has gone digital. There are no physical meetings at all. So we've managed to build in efficiencies amazingly into the supply chain. So our supply chain's margin as a group has gone up almost 300% from what we were doing earlier. So a lot of these initiatives have come in, and I think technology is the only way to go. Those people who do not embrace technology in healthcare now will be left on the wayside and will have a lot of things to do. People who justify themselves saying that, oh, healthcare needs the human touch, you need the touch of a doctor, is exactly like what retailers were saying 10 years ago when they said, no, you can't really sell dresses and sarees online because women are so finicky. They like to love to touch the material, feel it, how it goes with their various other things, how to match it. So you can't sell dresses online, and now we know what exactly has happened in the last few years for this. So we need to be very, very cautious of that and very conscious of the fact that the new normal is very different from what we were living 2 years ago, and it is sticking, and the behavior is very difficult to roll back.
Lovely. Wow. What best as an output of this particular question can come? Not if not you said that, Dr. Shuchin. Lovely the presentation and the way in a very easy mode you shared that with us. So ArdorComm Media would like to publish some of the initiatives of Medfo, sir, because this is something great work which you are doing, and definitely it has to reach to masses to to replicate the models of Kumaon region which you are doing over there. So 10,000 doctors at one platform, 21 states, 20,000 is not a joke, sir. Like, I really hats off and salute to your efforts. We would like, as a media voice, we would like to publish these initiatives, and I would like to present this as a landmark so that with that shared link, you can, pass on this kind of news to other platforms. Because as you said that you don't have any app or any website particular say to demonstrate that, but I would like to jot down as a as an editorial coverage, which would again with certain photographs, I would like to present it again to you so that you can pass on to the masses, because this kind of initiative should be applauded, sir, and they should need a recognition so that people should hear out, not only in this forum but outside this forum, ki what is things can be done rather than just cribbing ki ye technology महंगी है, ये technology use नहीं कर सकते हैं. So embracing the technology is something as an output I'm getting from this panel. Thank you, sir.
Thank you very much, Chandan, for that. Thank
where
you.
all these panelists have already given their best remarks, lot of responsibility comes on Dr. Mukund now, and that what is left he would like to put stress on. I would like to throw a better and a vast angle on telehealth and teleconsultation. Mukundji, would you like to highlight some of the things which missed out in the discussions as of now?
Right. Thank you very much for giving the opportunity. Actually, as Dr. Shuchin said, since 2 years, everything has changed now. and in telehealth also, everything is changing. So I would like to tell some experiences during the second wave first, because during that wave, as everybody knows, so many number of patients were there, and it was very difficult to manage. Because of the telehealth, the first thing which was beneficial was the management of beds. And in Pune, we had a very good communication with the government authorities, the Pune Municipal Corporation, and the private hospitals had a very good cordial relationships, and we could manage the bed strength during that period. And mainly, as you know, nobody may have mentioned, COVID is basically a mental problem. So everything, whatever the patient in first or second wave, anybody getting COVID used to think that now something is going to happen to that particular patient. So we had to counsel so many patients on telemedicine, and that was the best thing. Otherwise, the hospitals were not, the patients were not getting bed in the hospitals, and many patients who did not need bed were occupying the beds only because of their anxiety. So for that, we had to manage those patients on teleconsultation first. And we in Pune, we had a very good response of during this pandemic. Pune response for the Pune platform for COVID response. It was a very good initiative by Mr. Sudhir Mehta and Manojji Pochat. We had all the heads of the institutions from all the hospitals in Pune, and also all the heads from the industry. So what happened was, all the doctors were treating patients as needed, and there was a very good response from industry. Because as you know, there was a scarcity of ventilators, scarcity of oxygen and oxygen beds. So all these particular things were donated by this PPCR group, and we had a very good response. And overall, if you ask me, because of this digital platform, what happened and what is happening is, we are getting a lot of knowledge in time. As you know, most of the waves were initially in the foreign countries, in Europe and USA, and thereafter they came to India. So we already knew what is happening there, and we used to have meetings on Zoom with the foreign speakers, and we used to know what exactly is to be done beforehand, before the waves came in. So that was a very nice thing because of this digital technology. And I would say that India overall, and Pune as a city, have managed the COVID in such a way that our mortality was so less. It was otherwise, whenever it was stressed upon before the first wave or after the initiation of first wave, we used to think that India may not be able to manage so many number of patients. So many, there is a lot, there is a lot of patients, but we could do it only because of this digital technology. I must stress upon, because we used to have such a knowledge, and we used to transmit the knowledge to the rural areas also. Even the mobile phones are also good enough to have such kind of digital technology, and I think we should be open for it. 2 years back, nobody would have imagined that we may have to manage the patients on telephone or telehealth. But now this is the norm. And as you have taken such initiative early in the course, new normal healthcare, this is definitely a new normal healthcare now, and we have to go ahead with whatever is available. And definitely it is going to help all the population of India and Maharashtra and Pune. So thank you very much for giving me the opportunity to speak on
Yes.
this.
Yes, Dr. Mukund, very good inputs. In fact, I would like to know more about PPCR. Let me have a separate, a one-to-one chat with you, sir. As I told you, we have a separate product known as Innovative Leadership Talk Series. This is a fireside chat round and an interview series where we are inviting top leaders to have one-to-one, because in this 1 hour, I can just do the justice to the panel topic, not to the expertise or the kind work or a vibrant work under your leadership which you have done. But being ArdorComm is headquartered in Pune, sir, it will be a privilege to again come back to you, especially in fact to meet you in person and to get more out of how we can spread your good works and the PPCR initiatives under and what Sanjivan Hospital has been doing so far during this pre-COVID, COVID, and what your plans for the post-COVID era, so that it could be replicated by many of them who are witnessing you and seeing you. Thank you so much, Mukundji, for joining us. It was an honor to have, in fact, all the eminent speakers. I have to give a hard stop to the panel discussion because actually we are, going off the time. It's always 10 minutes delay to the scheduled time. But I think this kind of topics where there is a teleconsultation, lots of expertise and experiences which all leaders are carrying in your own space. 1 hour cannot be a justice, but again we need to, in small bits and pieces, I need to get more inputs and more thoughts from other speakers who are waiting for their experiences to share at that forum. With this, I would now thank you everybody for for being a part of this forum. And I would like to now invite Mr. Nitesh Kulkarni. He is the Deputy Director from Canop Sealing Solutions. And I invite him to do the honors for a felicitation. It is a recognition and from ArdorComm Media to these eminent stalwarts as a token of thanks to the society which they are giving. Over to you, Nitesh. Can you please do the honors?
Right. Thanks, Chandan. Fantastic discussion. I mean, it was really candid and insightful. I can listen to this the entire day, to be very honest. I would, like Chandan said, I would just like to recognize the panel one by one. So to start with, Ms. Upasana Arora, she's the board member at Ethical Committee, AHPI, and director at Yashoda Super Speciality Hospital. I think we have heard her overall, and her passion really speaks through the way she has addressed the panel. And she believes very much in the power of spirituality and enhancing the well-being. So thank you, ma'am. Next would be Dr. Anoop Mehta, Managing Director, Navjeevan Hospital, Hyderabad. So he has the experience of well over 13 years in dealing with different types of infectious diseases, complications, chronic diseases such as diabetes and hypertension. Thank you so much, sir, once again. Mr. Rupak Barua, so Group CEO and Director, AMRI Group of Hospitals, Kolkata. I think his name is quite synonymous when it comes to the field of healthcare services and administration in East India in particular. His experience is kind of very clearly visible. He has more than 30 years of experience in this field. Thank you, sir. Coming next to Dr. G.V. Divakar, MD, Divakar Speciality Hospitals, Bangalore. The combined wealth of experience in this group is just phenomenal. Sir has over 34 years of experience, and he's also serving as the MD of Asian Research and Training Institute for Skill Transfer, Bangalore, and also as the Managing Trustee for Divakar Service Trusts. Thank you so much, sir. Dr. Shuchin Bajaj, Founding Director, Ujala Cygnus Hospitals. I think one of the things which I would like to point out, which struck with me very much is that anybody who's not recognizing the fact that technology is the way forward, and that is what you exactly said. That is one thing which has hit home pretty heavily, at least for me. So thank you so much, Dr. Bajaj. Dr. Bajaj, one more thing, he is also a recipient for British government's 2015 Chevening Gurukul Fellowship for Leadership and Excellence Award at King's College London. Thank you so much, sir, for addressing us. And last but not the least, Dr. Mukund Penurkar, MD, Sanjivan Hospitals. Sanjivan Hospital, I have a personal connection to it. My parents have been one of the people who have been treated there, being them stationed out in Pune. So Thank you so much, sir. So, I mean, he's a institution is in himself. So he has acquired a vast experience through treating HIV positive patients and antiretroviral therapy through to his 2.5 years tenure at Art Center, BJ Medical College and Sassoon General Hospital. Thank you so much, sir, and thank you, everybody.